trusted voice in health and science.
Hello and welcome to Health Times TV, your trusted source for health and science news here in Zimbabwe. Today we have quite an interesting topic, fertility and infertility. Maybe before we delve into that, let me just invite you to subscribe right below on the subscribe button. Click, share and comment in the comment section so that at least we have more people on this conversation. So to discuss the issues of fertility and infertility, joining us today is Dr. Madziyire. So I will not take much time introducing him. Let him do the introduction himself. So Dr. Madziyire, thank you so much for joining us today. Maybe to start with, could you tell viewers a little bit about yourself, your background, and your medical specialty?
Thank you very much, Michael. Good day, viewers and listeners. My name is Dr. Gerald Madziyire. I'm an obstetrician and gynecologist for more than 2 decades now. I work for the University of Zimbabwe as a program director in the Department of Obstetrics and Gynecology, training medical students and both undergraduate and postgraduates in obstetrics and gynecology. I've got a special interest in fertility care. Fertility care is about helping people to conceive, people who wish to have offspring. So that's my main area of interest currently, but I do cover all the other areas of obstetrics and gynecology.
That's interesting. So now let's just start with the basics. People would want to know, when you talk about fertility, doc, what does it really mean for someone to be fertile?
Okay, so fertile is the ability to conceive or to propagate your genes forward. So each individual has got is supposed to have reproductive potential, meaning at some point, if the individual gets involved with a member of the opposite sex, they should be able to have an offspring.
So what would we say is a healthy or maybe a non-healthy reproductive system for the male and the female? What would we say?
Okay, so basically, if the system allows the two to be intimate and transfer their seeds, the seeds we call them gametes or mbeu ishona. So there could be problems even in that art of being intimate. It might fail altogether. So our problems start right from that external stage where people fail to be sexually intimate and therefore they can't conceive. Some are intimate, in fact most will be intimate, but somehow either the gametes, which are the eggs for women, or sperms for men, are not functioning well or are not even there at all, then they are not able to conceive. Some the gametes are there, the eggs and sperms mix, but somehow they cannot get seeded within the uterine lining. There are blockages along the path or something growing inside the uterine lining, which makes it impossible.
Some wonder why some couples find it easy to conceive. They don't even struggle. Like, you find even you move around the streets, you see even those who live in the streets carrying their babies. But some, we've got everything figured out. They struggle to have offspring. Could we just talk about that?
So naturally it's supposed to be so easy and automatic. But however, I do know that up to 15% of couples struggle to conceive.
15%?
15%. So it's actually quite
50 or 15?
15.
Okay.
Meaning out of 100, 15 will struggle to conceive. Yeah.
That's a huge number.
Yeah.
So what would you say are some of the main factors that affect fertility? And are there some lifestyle or medical conditions that we should be aware of that actually affect fertility?
Definitely, there are both male and female factors, which are almost equal in proportion, which makes conception difficult. So we always have underestimated the male factor in our society, but it has become apparent that they're almost equal in proportion with the female factors. So starting with the male factors, the most common cause will be problems in the sperms. It's either it's not normal or it's inadequate or it's totally absent. So remember the sperms are produced in the testicles, atoti mabhora inshona. Yeah. For some people, they will have problems already with those mabhora that they didn't develop. Some remained up in the abdomen, some twisted, or there are some genetic causes. One is just born like that with testicles which don't function well and they don't produce the sperms well. Some pick on problems later, either they get infections in my testicles or the tubes coming from the testicles to deliver sperms get blocked. So these are acquired problems they develop later on in life. So things like sexually transmitted infections can take away that ability or block the tubes, or you can have conditions like mumps causing infections in testicles.
Maumunya.
Yes, but those ones being affecting the testicles in particular. Okay. Then for females, some women don't ovulate. In the normal cycle, an egg is supposed to develop each month. For someone, that process doesn't happen. When they are not ovulating, we call it an ovulation. So I was quite as area every month to produce a baby. Then some women have got blocked tubes. Tubes can be blocked because of infections. Pamane continue endometriosis. Endometriosis equal to lining emkati which be during my period. In some women, it's also is all over around it. It can cause reaction. It's like they are bleeding everywhere else around the tubes, around the ovaries, inside the tummies, and then they eventually can block the tubes or even disturb the internal structure inside the uterus, so that it can't accept a fertilized egg. Yeah, some can have abnormal uterus, in the worst case being the uterus not being there at all.
Zviri kwezvo zvochiremba kuti munhu anenge asitorina chibereko
zviriko chaizvo zvitoripo.
Okay. Chii chinenge chaitika
padevelopment process yacho pane zvinodhara tonge kuine chibereko. If there's a defect in those genes and the chromosomes, those things won't happen. So you can have a normal looking woman without the uterus and tubes.
mambotaura chiremba tisati taita pa next question kuti kutori na vamwe varume kuti anenge asitori na the seed.
Yes.
Okay, unenge wazvarwa wakadaro.
Yes.
All right.
Yeah.
Interesting. So you touched briefly on the issue of like 50% of fertility issues are also male related.
Yes.
But society has a tendency of blaming women when a couple fails to conceive or to have children. So you are saying male are equally affected as women, 50-50. Saka zvekublemana zvezvo kuti mukadzi kana pakashayikwa mwana murume unoti mukadzi mhosva yako. There's no basis for that.
Yeah.
Okay. Makapoza anenge adaro chiremba, let's say maona imimi kuti hatina nhumbu. Tisati tablemana kuti mukadzi murume. Pane matest here anokwanisa kuti aitwe.
Definitely. So we want husband and wife to come together for evaluation. So we actually check their history to know what's the problem. Firstly, how long have they been trying? We only define infertility if people have finished 1 year of trying to conceive, staying together, having regular sexual intimacy, but not to know infertility. Because of normal couples staying together, it's only 85 out of 100 who conceive within the first year of staying together. Okay. So it's very important that people are not impatient and they quickly start blaming that they've got a problem when it's actually just an issue of time. Okay. The ability to conceive or the probability of conceiving each month on a normal couple is just 20%. So human fertility is not that efficient.
So it's not like are fertile like Mzimaya has fertile mwezi.
No, just the only fertile for about 48 hours a month.
48, okay.
Yeah. Okay. Yeah, in that 48 hours, for any reason, the conception can fail. Right. Yeah. Yeah, so it's not like every time. Yeah.
So tobotasa nyaya frequency chiremba because mukadzi ari fertile for 48 hours. If you miss that period watopona.
Yeah.
Vanhu vafana kuita bonde kakawanda sei?
Okay, if they are just going to do it randomly, at least 3 times a week makes them catch the fertility window. But some can actually do what we call timed intercourse. For instance, they are not able to be intimate that frequent. Some don't even stay together. They can then now use a calculation to get what we call a fertility window. That's the time when when the egg is going to be produced. So people can time, if you are staying apart, apart from your wife, one is in Bulawayo, one is in Harare, you then time your visits that they happen at a time when you know the egg will be produced.
Yeah. Mukuzvinzwira zvanzi at least 3 times a week kana muri married muchida kuti muite mwana. Pane nyaya yemafibroids, the issue of fibroids, doc, how does it come into play with regards to issues of conception and fertility?
Okay, so fibroids always say they've got an egg-chicken relationship with infertility. You actually don't know which started. Because fibroids tend to grow in a womb which has not been able to hold a pregnancy. Yeah, so we actually call them stones of a disappointed womb. Okay. So if a woman delays in falling pregnant, she has a higher probability of growing fibroids, and also fibroids they are also common in black women. So though there's a probability that the fibroids can actually sit in the inner uterine lining and then they disturb ability for conception, ability for the fertilized egg to be seeded in the womb. They can also sit around the tubes and disturb transport of the egg, to meet the sperm.
That's interesting. Then, Doc, you also find that couples conceive, they struggle to conceive even when everything seems normal. I've heard in some circles others talking of compatibility tests, blood compatibility. Sometimes maybe you are not compatible, and probably you should take a compatibility test to see kuti ropa redu rinopindirana here. Zviripo here chiremba izvi?
Okay, first and foremost, what we do know is that up to 20% of couples have what we call unexplained infertility. Hatigone kuitsanangudza. Taita matest kwamuri taita matest kumudzimai wenyu, and then we don't see any reason. We actually think there is a likely genetic cause. In fact, we are doing a study right now in Zimbabwe and other countries called genetic associations of infertility. We are saying couples who have never had a child who are willing to go through the study, they come, we do the study at the Parenya, and we are actually trying to check whether there are genetic problems which can identify in our population. So there's that aspect which we are not able to explain. Then, of course, there's an issue of incompatibility where for one couple, they try while they are together, and then when that relation falls apart, one will go and conceive also, or both of them will go and conceive. Yeah, but it's a very small factor. Yes. Yeah. Mm.
So we're talking about compatibility, Chiremba. A couple can fail to conceive, but maybe with that in mind, what should couples consider before marriage, just at least to see or to know if there is compatibility issues?
Okay, that's a difficult question because we are now touching on issues of ethics and morality. So you say the way society defines people must fall in love first and marry. They must not test their fertility. So it's a very difficult one to answer or advise people on. So we usually say once you find yourself in a situation, then you just have to accept and deal with that situation. Otherwise, it's almost like promote promiscuity where people are busy trying and testing whether they will be compatible or not. Okay, so maybe to just bring you back slightly, I know it said what are other preventable things. Yes. Yeah. So maybe because there are some low-hanging fruits which you can pick. So number one and foremost is responsible sexual behavior, because infections do block our tubes a lot. Yes. So probability of having the blocked tubes is higher if people are having multiple relationships. The common sexual transmitted infections like chlamydia and gonorrhea damage tubes a lot. So we need to put emphasis on responsible sexual behavior. Then there are also lifestyle issues. Obesity will usually reduces the chance for conception. So people must be active and probably try and maintain a healthy lifestyle. There are other conditions which can also cause infertility or failure to ovulate, in particular for women, like thyroid disease, which needs to be screened for. There's a condition called hyperprolactinemia, where they produce a certain hormone. Prolactin is a hormone which causes milk production, and sometimes it's just elevated in some individuals, and they won't ovulate because that's nature's protective way of making sure a lactating mother is not falling pregnant. So we check for those as a baseline survey. Patients or clients with so much pelvic pains, we check whether they don't have scarring or sticking together of structures due to endometriosis or infections.
Yeah, so maybe let's move to the solutions, Doc. We've talked about the causes of infertility, the challenges, amongst other issues. There's issue of IVF, in vitro fertilization. It's becoming more common in Zimbabwe now. So I just want to find out, how does IVF work, and who is suitable for that?
Okay, there are clients who cannot be intimate. Some have got important ability to maintain an erection adequate enough for intimacy. Yeah, there are ways of introducing sperms into the female reproductive tract, what we call insemination. Yeah, then for men with zero sperms, sometimes, and we can't get the sperms even when we check for them in the testicles, then they can need what we call donor sperms, where either donor, a known or unknown donor. Women, again, with no eggs can get an egg donor. Women with no uterus can get what we call a surrogate. They now come to the IVF, which you've asked about. So IVF is now trying to manipulate the system so that we do it outside the normal environment. We stimulate the woman to produce eggs. We take those eggs, we mix them with the sperms, and then they fertilize. Outside, yeah. Then that fertilized egg, we now put it back into the uterus. Yeah, to facilitate the pregnancy. Yeah. Yeah, that's the simplest way to explain it. Yeah, obviously, it's very technical.
So zai nembeu zvinotorwa zvosanganiswa kunze uku zvasangana mashuwa kuti zvasangana motora zai back.
The fertilized egg ndio atakuti embryo ndo mwana ane few cells akusakuita muchibereko chamai.
Okay. That's good. And success rate yazvo yakamira.
Success rate, it's couple dependent, but it goes up to 60% when everything is ideal. So it's not 100%, meaning really it's something where people have to be counseled properly, because given your situation, your success rate might be 60. It's affected by things like the number of eggs we expect to get. For women, basically after the age of 30, we start getting less and less eggs. After the age of 30. Yeah. Okay. So that's usually the general trend. Of course, a few exceptions, but the older the woman, the less eggs we are likely to get. It's also affected by very poor sperm quality. Yeah, so that lowers the chance. So expect very lower success rates for elderly couples. For men, quality of sperms gets also drastically reduced after the age of 45. While men can continue reproducing, but the machinery making the sperms become poorer and they get more defects. Okay. Yeah, so age is a definite factor.
It's talking about interesting. Yeah. For a man, kuzoda kuzoita vana wachembera. Madefects anogona kuzosanganikwa nawo muvana ndeapaka.
Yes, there are chromosomal abnormalities which multiply more the elder the couple is. For women, those problems start really become significant after the age of 40. For men, it could be a bit older than 40, but definitely when both of them are above a certain age, well above 45, you've got so much of those issues. So firstly, the chance of failure becomes higher because the body does screen out and try to accept only the normal embryos or normal babies. So chromosomal problems like Down syndrome. If we only see Down syndrome, because that's the common surviving one. Majority of them, they won't even survive. Yeah. Okay.
What are some of the myths that you have encountered within the line of work?
Okay. Within our culture, people think issues which have happened within the family line, like kusarwa makuva, kubisarwa mombe yomai, those are cited, and people say no, we are akasungwa mbereko because of 1, 2, 3, 4 inyaya dzakaitika within the family. Yeah, so that's the advice which people get when they go to other practitioners. But of course, us being scientists, we only follow what's evidence guided.
Okay. And Doc, are there any emerging treatment options with regards to fertility?
No, I think the treatment, most advanced form of treatment is in vitro fertilization. Yeah, that's the most technical. We call it assisted reproductive technologies, and that's the topmost of approach which is there on offer. And the art is spreading. Many countries are adopting, even in the public sector. Even now in Zimbabwe, we are trying hard to have it available in the public sector, so that couples who really don't have normal reproductive function can now bypass their problems.
Let's focus on couples. What lifestyle changes can couples make to actually, increase their chances of conceiving?
Okay, the other thing which we didn't mention particularly is the alcohol consumption. It affects in particular sperm quality. So sperm quality does improve if people drink their alcohol. So this refers to those people who are taking too much alcohol. Yeah, because there are products which then affects the sperm, which affect sperm quality, which come in the testicles when people are taking too many toxins. So that goes for alcohol and other drugs. Smoking as well is there. So we do advise people to either stop or drastically limit the alcohol, to stop smoking as well. It affects sperm quality, in particular sperm movement is affected. Yeah.
Warm baths and tight-fitting underwear and pants in male, they also contribute to that. Could you just also touch on that?
Yes, sperms are produced in a low temperature environment. So for all the male animals, the reason why testicles are hanging is for the cooling effect. And they not see even testicles tend to have the wall has got so many, call them wriggles, rinking or something. Yeah, it's to increase the surface area. So anything which promotes too much temperature into the testicles will reduce sperm quality. That's why you say men must not be in hot water for too long, especially those with problems already. And then also avoid too much underwears. The people who put in the mini briefs, the boxer short, and then the trousers on top. yeah. So you need to keep the environment as low temperature as possible. Zimbabwe are not a motorbiking country, but countries like India, they do emphasize that when you're on a motorbike, you're sitting on the engine, so you're already adding heat to the testicles. I have not heard laptop in particular, but potentially anything which just which adds a heat to your testicle area will affect the sperm production or sperm quality.
Then finally, Doc, for anyone watching this show who might be struggling with infertility, what advice would you give them?
Okay, so number one and foremost is really to accept it like any other condition, like diabetes or like hypertension, anything which can be managed. Because the problem we face is stigma, where people are not willing to come forward, especially the men. So they should just accept it, and society should also not use derogatory words when describing issues of fertility. There are terms which are said recklessly in the community, like Fayama Blank, she, Anita Wejongwe, or whatever. All those things, they make people stay away. Because unfortunately, men are measured by their ability to conceive, their virility. And then meaning those who have got issues now, they tend to withdraw and hide away. People say this jokingly and so forth. So then it affects the health-seeking behavior. These men, either they then start trying randomly to conceive, trying to see as many women as possible, and then they end up acquiring so many diseases, which works against them. So I think society must firstly embrace that this problem may affect both men and women, and accept this as a condition, like any other condition which exists. And then when these people can then come for help, they approach their medical practitioners. If the problem is complicated, they are referred to specialists for further care. Maybe just a quick one. We are expanding the service. All provincial hospitals have got gynecologists. At Paro, we even have an infertility clinic. There's an infertility clinic at Tungus Hospital, at Salem Gaibo Hospital. UBH, they are setting up their infertility clinic, and I'm sure on Pillow soon. society is expanding, and they also mentioned that we've got the study which we are doing at Pare called Genetic Association of Infertility. Those people who don't have children and who don't have an obvious reason can actually come, and then we check them out.
When can you expect this study to be finalized?
It's supposed to run for 2 years.
Okay.
So I think now we're left with over 1.5 years.
That's good.
Yeah.
That's great. We are looking forward to that, Doc.
All right.
Thank you so much. The closing. What did I say here? That one.
Salem Mugabe Hospital, UBH, they are setting up their infertility clinic in
that, Doc. All right. Thank you so much. Thank you, viewers. That was Dr. Madziyire, who joined us today to discuss issues around fertility and infertility. We hope next time he's also going to join us to expand more our understanding of these issues. So thank you so much, viewers. Until next time.
Put Health Times TV, your trusted voice in health and science.